Hello, everybody. Thank you for joining us for today's webinar on eating well and maintaining a healthy lifestyle to impact mood disorder management. We are so excited to have Dr. Michael Berk with us today. Dr. Michael Berk heads the Impact Strategic Research Center at Deakin University and is also an honorary professorial fellow at the Florey Institute of Neuroscience and Mental Health at Orygen's National Center of Excellence in Youth Mental Health in the Department of Psychiatry at Melbourne University in Australia. He also serves as a visiting professor at the Guiyang Medical University in China and an honorary professor in the School of Public Health and Preventive Medicine at Monash University in Australia. He is also a member of our Scientific Advisory Board. Dr. Berk is an ISI highly cited researcher who has published over 750 papers, predominantly in mood disorders. His major interests are in the discovery and implementation of novel therapies and risk factors and prevention of psychiatric disorders. He is a recipient of a number of grants. Thank you so much for joining us, Dr. Berk.
Thank you very much. It's my great pleasure to talk to you about lifestyle and how this might influence the management of people who have mood problems. I want to credit the Food and Mood Center, which is part of my team at Deakin University, who have done a lot of the work in this area. There have been major changes in what people have eaten, what people are eating over the past few decades. If you're having a look at this graph coming from The Economist, it looks at the changes in what people are eating over a very brief period of only the last decade. And what you can see, there's a substantial reduction in the amount of fresh meat, fruit and vegetables, and a substantial increase in processed foods like chocolates, pizzas, and ready meals. In Australia, adolescents now get almost 50% of their calories from highly processed or junk foods. Another way of looking at that is if you look at food consumption per week, the consumption of fresh green vegetables has declined precipitously over the past few decades, and the consumption of ready meals and junk foods has gone up dramatically. So when you look at the global burden of disease, which looks at the global risks for risk factors for all disorders, at the very top of the list is diet. So both in the forms of malnutrition and unhealthy diet are the two largest single causes of health problems in the developed world. This is a remarkable change. And this is true of high-income countries as well. So the first slide I showed you is in low-income countries. In middle or high-income countries, right at the top of the list is poor diet. It's the largest single risk factor for common non-communicable diseases in the societies that we live in. So what is a poor diet? Very simply, a poor diet is a diet that's low in fruit, vegetables, whole grains, nuts and seeds, fiber, and particularly nutrients like omega-3 and polyunsaturated fatty acids. It's also a diet that's high in red meat, processed meat, added sugars, sugar-sweetened beverages, trans fats, and sodium. So our group did the first studies on the relationship between diet quality and affective disorders. This was published in the American Journal of Psychiatry. And we looked at a group of people from our Geelong osteoporosis study. And we were able to show that people who ate a healthy diet had a lower risk of developing depression, and people who ate an unhealthy diet had a much greater risk. This has now been extensively replicated in a very large number of studies across a diversity of countries and across a diversity of populations. So we now are at a level where it is clear that diet is a major risk factor for health disorders, for mental health disorders. This is true across the age spectrum, it's true of the elderly, and it's true in children, and it's true in adolescents. Before we go any further, I need to explain to you a little bit of nerd stuff. So there's a thing called a forest plot, and I'm going to be showing you a few of these. So to understand a forest plot takes a number of individual studies, puts them together, and comes up with an aggregate of all the studies that we've got. So if you look, there's a vertical line, which is the line of no effect. If the whiskers on the boxes cross the 0 line, it means there's no effect. So if you look at the top box, that crosses, therefore it's of no effect. And if you look at the second box, that doesn't cross, therefore it means it's significant. And if you look at the diamond at the bottom, that's the aggregate effect of all the studies. Again, if the diamond doesn't cross the line in this graph, it doesn't, it means there's no effect. And it can be better or worse. The bigger the box, the greater the effect of any individual study. So this is an example of a forest plot of all the studies that have looked at the relationship between a traditional diet and depression. And all the studies, as you can see, the majority of the studies are on the left side, meaning that there's a reduced risk of developing depression if you are on a healthy diet. And the diamond, as you can see, is well on the left, and it suggests a 30% reduction. So you can reduce your risk of depression by 30% by eating a Mediterranean diet. If you look at a slightly different measure of diet quality, not a Mediterranean diet, but just a healthy eating index, which again looks at fruit and vegetables, whole grains, fish, meat, non-processed foods. Again, this way of looking at it says that it's a 35% reduction. Another way of looking at this relationship is looking at a thing called the dietary inflammatory index. Now, we know that junk food increases the amount of inflammation. It activates the immune system and it primes it for action. And this, in a chronic sense, is not good for you. And you can see here that people who have a healthy diet have a lower inflammatory index and they have a reduced risk of developing depression. In this case, 30% reduction. So let's look at some specific age groups. Felice Jacker from my group did one of the first studies looking at the relationship between diet intake and mood in adolescence. So in the top graph, you can see they've broken down diet into 5 groups, rating from the healthiest to the least healthy. So those people in the top graph who had the lowest intake of healthy foods had the highest risk of depression. In those people who had the highest intakes of unhealthy diet, on the bottom graph, you can see they had the highest rates of depressive symptoms. So this cuts both ways. So diet plays a very significant relationship between mental health in adolescence. And need to emphasize that there are many other variables in these studies that might influence this relationship. And so these studies adjusted for things like age, gender, parental work status, parental education, socioeconomic status, family conflict, family management, physical activity, smoking, and even whether the adolescents were wanting to diet or not. So what about children? So again, Felice Jacker in my group did a very interesting study looking at prenatal diet. In other words, the diets that mums had while they were pregnant, their postnatal diet, what they ate and what the kids ate in their earliest years of life, and followed them up to see what was the mental health of kids at 18 months, 36 months, at 5 years. And again, this study adjusted for a whole variety of factors that might influence these results, like age, education, parental income, marital status, whether the parents had depression or anxiety, whether parents smoked, whether mum's role, how many kids mums had, and also this parental control. In other words, the sense to which mum had a sense of control. The bottom line was that higher intakes of unhealthy foods by mums when they were pregnant led to higher externalizing behaviors in children. So externalizing or acting out behaviors, things like attention deficit and conduct disorder symptoms. Mums whose kids in the early years of life had more unhealthy food had both more externalizing, that's the ADHD conduct disorder type symptoms, as well as internalizing symptoms, that's depression and anxiety, in their kids. So the kids' diet influenced their mental health. And those kids who had lower intakes of healthy foods had more internalizing and externalizing behaviors when they grew up. This has now been replicated. So an English study called the Generation R study was able to find a similar thing. So the quality of their diet, and they looked at a Mediterranean and a traditional Dutch diet. And again, there was a very similar relationship such that the better the quality of the maternal diet during pregnancy, the lower the risk of mental health problems in kids. Again, another study has found the same thing. So this is a study of 7,000 mother-baby pairs, and they looked at depressive symptoms during pregnancy. And they found that the worse the diet in the mums, the worse the depressive symptoms they had. And both high levels of unhealthy diets and low levels of healthy food intake were associated with poorer cognitive functioning, that's intellectual functioning, as well as more emotional problems in their offspring. And this was again independent of whether the mums had depression in postnatally, and it was also independent of postnatal depression and a range of other social, demographic, and family factors. So we're now in a position where we can take all the studies, put them together, and again, if you look at this forest plot, just focus on the diamond right down at the bottom of the figure, and the bottom line of this is that better maternal diet is significantly associated with better child neurodevelopment. So you have better cognitive outcomes, this is intellectual outcomes, in kids who have a better quality diet. So one of the important questions is this what they call reverse causality? In other words, do better people who have better cognitive and emotional factors have better quality diets? And again, this has been studied and the answer appears to be no. So it doesn't appear that being well and mentally healthy leads to better quality diet. The relationship seems to be the other way around. So it's all very well and good to look at cross-sectional studies and epidemiology studies. The most important question that people who have depression want to know is, if I improve my diet, will my mental health improve? A short number of years ago, we had no data, but now there are a number of really important studies that can inform the answer. The first came from a fabulous study called the Preventive study. They initially tried to look at the prevention of cardiovascular disease with a Mediterranean diet, but there was enough information in the study to answer some mental health questions. So there were 3 groups in the study. Some people were just given advice, low-fat dietary advice. Some were given Mediterranean diet with extra virgin olive oil. EVOO is extra virgin olive oil. And the other group got a Mediterranean diet supplemented with nuts. All of the groups got intensive education and support, and they were followed up at baseline and every 3 months. And what you can see here, when they followed up people for an average of 4.5 years, there were 224 new cases of depression. But if you look in yellow, the group that had Mediterranean diet with nuts had an odds ratio of 0.59. So that's a 60%, almost 60% reduction in the risk for depression. The group that had Mediterranean diet with extra virgin olive oil had a 71% reduction, but this was not statistically significant. So the group that was significant was the Mediterranean diet with extra nuts. So Felice Jacker from our group did the first randomized controlled trial called the SMILES trial, which tried to determine whether if you take people who have depression and you randomize them to either psychological support or diet, which group has the greater benefit? And these are the results of the study. If you look at on the left at the diet intervention group, there's a greater reduction in depressive symptoms in the diet group than in the social support group. And this was statistically significant. As much as an initial positive study is exciting and important, scientists only really pay attention when these are replicated. Unfortunately, there's now enough evidence to say that these data are replicated. Another piece of information that helps you have a bit more confidence in the study is not everybody who was put onto the diet stuck to it. So this is whether you stuck to the diet. So we looked at adherence, and we broke people up into 4 groups, into 4 quartiles. Quartile 1 was not adherent at all. Quartile 2 didn't have much adherence, and quartile 4 were highly adherent to the diet. And you can see here that the scores dropped much more dramatically in the group that actually stuck to the diet. So that kind of fits. We also did an economic evaluation. So we looked at lost time, absenteeism. We looked at visits to healthcare professionals, cost of delivering the interventions. And the bottom line is that compared to the psychological social support condition, total health sector costs were $856 lower, and societal costs were $2,591 lower for those who received the dietary support. And this was mainly due to lower costs arising from fewer allied health and health professional visits and the costs of unpaid productivity. So as I said, this data has now been replicated. So a very nice study is by Natalie Paoletta, which came out a couple of years ago, where she compared again a Mediterranean diet with social support and found almost identical results. Another paper came out this week. I'm not going to show you all the data of all these studies, but again, it shows almost identical photocopy type results. So the more studies that we have that show a beneficial effect of diet in treating depression, the more confident we can be that this is a real effect. So let me summarize. A dietary intervention delivered by a dietitian can improve the symptoms of major depression. The healthy diet was cheaper than the baseline unhealthy diet, and we think that this result has significant implications for the treatment of depression. Not only that, because diet is an important risk factor for other non-communicable diseases, NCDs, apologies for the acronym, healthy diet is also likely to lead to improvements in other non-communicable diseases like diabetes, heart disease, hypertension. And economically, this is cost effective. An important question that people always ask is, okay, I eat a junk food diet. I like it. But can I take supplements? And is this as good as staying on a healthy diet? Unfortunately, the maths doesn't add up, and it doesn't seem that you can translate a junk food diet into a healthy diet simply by taking supplements. But let me tell you a little bit about the supplement evidence that we have. So we've just done a systematic review of nutraceuticals in depressive disorders. And we know that nutraceuticals are often used for people with mental health and other problems. Indeed, almost 60 to 70% of people in the general population take one kind of nutraceutical or another. And the evidence that these are beneficial is sadly very lacking. Still, we often need augmentation strategies because not everybody gets well on antidepressants or psychological therapies. At least in theory, many of these nutraceuticals have the potential to influence important neurochemical pathways. And if we looked at the literature, there's positive results for some nutritional supplements, particularly S-adenosyl methionine or SAMe, methylfolate, omega-3, and vitamin D. There's some isolated positive studies on things like creatine and amino acid formulas, but not good enough for us to make clinical recommendations. And they're very mixed results for things like zinc, folic acid, and vitamin Z and vitamin C. So if you look at the evidence on folic acid, it's uncertain, because if you look at the diamond at the bottom, the diamond crosses the 0 line, suggesting no significant or clear benefit of folate in depression. The fish oil stuff is more significant. Here you can see the diamond at the bottom of this forest plot on the right of the 0 line, suggesting that omega-3 fatty acids may be of benefit in people who are taking depression. So Jerome Saris, a collaborator of mine, has done a fabulous study looking at a multi-nutrient approach to treat depression. So what he did is he thought, okay, if all of these supplements might have a little bit of benefit, why don't we throw them all together? And there's a good rationale for many of these. So zinc, S-adenosyl methionine, and fish oil have a role in growth of cells and survival of cells. Things like omega-3 and zinc influence inflammation. Many of these monoamines might play a role in the neurotransmitters or monoamines. They might have an influence on the hypothalamic pituitary axis, like cortisol. And at least in theory, some of these can influence circadian rhythms. So there's good theoretical reasons why these should work. So what Jerome did is he combined all the top line candidates, S-adenosyl methionine, SAMI, and all the combined nutraceuticals, and we put them all together, and we looked at whether these agents were beneficial. Completely to our surprise, we got a large study with a full sample of 234 individuals. If we look at the people who got the combination nutraceutical formula, they actually did worse than people taking placebo. So it was well tolerated. There were no significant side effects. But the people taking the combination nutraceutical actually did worse than people taking placebo. So we did not find, not only did not find any benefit for this, but it actually looked like people were getting worse. We can't explain why, but we did not find a nirvana here. So if nutraceuticals aren't useful, what else can be done? So I focused largely on diet, but I really want to emphasize exercise. When we look at the epidemiology evidence, it's very, very clear that those people who are engaging in high levels of physical activity have a significantly lower rates of becoming depressed. So let's just focus in on the top left-hand figure. Again, as you've seen with some of the previous figures I showed you, people in these studies are divided into 4 groups. Very low levels of activity, low levels, moderate, and high. And when you look at depressive symptom scores, on the left, it's a measure of depression called the Center of Epidemiological Symptoms on Depression. The scores were much lower in people who were highly physically active. So whether they're currently active, previously active, or habitually active, if you are physically active, you have round about a 60 to 70%, a 30 to 40% reduced risk of being depressed. We also know that exercise is a very important tool for the treatment of depression. And unlike diet, where there are only a few recent studies, there is now a very good body of evidence to say that if you are physically active, you not only can treat depression, but you can reduce the symptoms of depression and reduce your risk of developing depression. So this graph I'm showing you is the prevention of depression in people who are physically active. So you can treat depression by being physically active, and you can also reduce depression. Smoking is another very important factor, and I think it's a factor that most clinicians and advocacy groups pay little attention to. One of the tragic realities is that smoking in Western populations is highly prevalent in people with mental health problems. And we've known for a long time that, that a majority of people with disorders like schizophrenia and bipolar disorder smoke. Many people have thought that this is just a consequence of the illness. But we now know that smoking is a risk factor for mood disorders. So we did this paper almost over 10 years ago, where we followed a group of people who were either non-smokers or smokers, and we looked at the time it took and the probability of them developing depression. And what you can see is that smokers in the red line had a much greater risk of developing depression than non-smokers. We know that smoking is a risk factor for depression. What's not well appreciated, and I think the message really needs to get out there, that if you stop smoking, your mental health will improve. So this, for me, is one of the most important studies in terms of smoking in the last decade. So this looks at all the studies exploring mental health outcome in quitters. And if you look at the red arrow pointing to the diamond on the bottoms, you can see that if you quit smoking, you have a reduction in stress, a reduction in mixed anxiety and depression, a reduction in depression, and a reduction in anxiety. So my view is that smoking, rather than being something you should go to one day if you feel like it, smoking cessation should be a first stop, low-hanging fruit strategy in managing depression. So let me just give you a couple of recommendations about prevention and treatment. We should be following a traditional dietary pattern, such as a Mediterranean, but a traditional Norwegian, a traditional Japanese diet, they all work. Simply put, you need to increase your consumption of fruits, vegetables, legumes, whole grain cereals, nuts, and seeds. Probably useful to have foods rich in omega-3s like fish. Very important to limit your intake of processed foods, fast foods, commercial, bakery goods, and sweets. Replace healthy foods with nutritious foods. This might sound a bit tongue-in-cheek, but I have a couple of simple rules. Does it rot? Anything that rots is probably good for you. Fish rots, fresh bread rots, vegetables rot, chips, Coke, soda, that doesn't rot. Another conclusion is that supplements are probably of uncertain value, with the possible exception of fish oil. There's the evidence that supplements are going to cure these disorders is not compelling. And let me summarize by telling you about my clinical philosophy. So to do this, I'm going to tell you the story of the Sky cycling team. So the Sky cycling team is a British cycling team. They were useless. They were so bad that bicycle manufacturers would not let them use their bicycles because they would tarnish the brand. So they had to buy their own bicycles to compete. And they got a new coach. And the coach said, there's no miracle path to success in cycling. We can't find a single nirvana. What we're going to do is try and improve every tiny thing by 1%. So we want 1% better nutrition, 1% better training, 1% more streamlined bicycles, 1% better rest, 1% better physiotherapy. And the theory is the power of tiny gains. It's like compound interest. So mathematically, if you do things 1% every day, you end up at the end of a year 37 times better off. And what happened to the British cycling team is they went from being the worst team in global cycling, or one of the worst teams, to multiple winners of the Tour de France. And the person you can see there is Chris Froome, who is the team leader and the Tour de France champion. And I believe the same is true in managing depression. Occasionally, You go onto a medication and you're fine, but often that's not the case. And my own take is, what you want to do is lots of things and look for, maybe in mood disorders is not 1%ers, it's 5%ers. But diet is a 5%. Volunteering is a 5%er. Spending more time with your friends is a 5%er. Spending more time with your hobbies is a 5%er. Exercising more. Taking your dog for a walk every day. Stopping smoking, well, that's probably more than a 5%er. Being good, focusing hard on being adherent to your medication. Getting good psychotherapy in. If you can't get face-to-face psychotherapy, there's now web-based psychotherapies. And over time, with marginal gains of many things in small amounts, adds up. And I believe that many people will have a much better outcome of their disorders by using this philosophy of the power of small or marginal gains. So let me start off by thanking my collaborators at the Food and Mood Center. The work which we do is a team sport, and I'm indebted to an amazing group of people who generate the work that I have shown you. So this is our team, and again, I'm privileged to have a truly amazing group of collaborators. Lastly, for those of you who are interested and passionate about bipolar disorder, I'd encourage you to join us at the ISPD meeting in Chicago next year. We have a very strong focus on advocacy and patient support and inclusiveness. So please join us there. And thank you for your attention, and I'd be pleased to take any questions that you have.
All right, everybody. Thank you so much for that informative presentation. I hope that everybody greatly enjoyed it as I did. And we are going to take questions now. So for those of you on our Zoom, you can type the question into the chat portion or the Q&A. And if you are watching from Facebook, you can just drop a comment. Oh, okay. Our first question is, how do they measure inflammatory index? Is this a test that I can get?
The way that you measure an inflammatory index is you measure diet quality. So you measure the foods that you eat, and you enter this into a questionnaire, and there are programs that can calculate your inflammatory profile. There are tests that you can do, blood tests, where you can measure one's levels of inflammation. I think it's also important to mention that there are many factors that influence inflammation. Diet's one of them. Physical inactivity increases inflammation. Being sedentary is pro-inflammatory. Stress is pro-inflammatory. Many medical conditions are pro-inflammatory. So diet is only one of many drivers of inflammation. But then it goes back to what I said earlier about looking at a multitude of interacting factors and really trying to target all the factors that are relevant to an individual.
Okay, the next question is about veganism and vegetarianism, and this person would like to know if in the Mediterranean diet, Norwegian or Japanese diets, if the animal protein is what's important, or can that be supplemented by plant protein?
That's not well studied. We've done 1 or 2 studies, and we showed that lean meat actually was beneficial for mental health. But that doesn't mean that a vegetarian diet is not a useful way to go. So if you were going to be on a healthy vegetarian diet, that would certainly be an awful lot better than living on pizzas and burgers. Whether small amounts of meat or fish are really necessary, I think we need more data. As I said, the small number of studies we did suggest that meat might be helpful, but I certainly would not tell anybody who is vegetarian or vegan not to be vegetarian or vegan. I don't think we have good enough evidence either way.
Okay, thank you for that answer. The next question is if the Mediterranean diet is the best to eat with extra virgin olive oil and nuts, or can a low-carb diet be just as good?
The low-carb diet is a very interesting beast. At its extreme, there's a diet called the ketogenic diet, which is largely where much of the calories comes in the forms of fat and protein. There are theoretical reasons why a ketogenic diet might be useful for some disorders, but we have no evidence at this stage as to whether a ketogenic diet genuinely is useful for mental health problems. There are a number of groups that are looking to study a very low carb or ketogenic diet. I think it's worth making the point that a ketogenic diet that is loaded towards animal protein. So if you're going to be living on bacon and eggs, this is likely to be not good for cardiovascular health. And so there are some people, so Anu Runusen, who was with our group and is now in Finland, is looking at a more plant-based ketogenic diet, eating lots of things like avocados. So those kind of diets are being developed. But again, I would be cautious in saying that at this stage, we don't have any good clinical trial evidence to make clinical recommendations about a very low carb or ketogenic diet.
Do you have a particular exercise that you would recommend as the best to start with?
That is a very important question. And a lot of people have this idea that there's some magic exercise out there that they should be doing. My own take is it doesn't really matter at all. So any exercise that you can do that you enjoy. The most important thing is, what do you enjoy? It also depends on your phase of life. So if you're 70, taking the dog for a walk an hour a day is fabulous exercise. If you are 17, playing basketball might be more fun. So it's whatever you like doing. There's some studies that have looked at comparisons of aerobic exercise, running or jogging, or resistance training, so weights, and they both seem to be useful. My own take is that anything with a structure to it is useful. So if you have a group of people that you're exercising with, so you have rowing, and you doing fours, and you're one of the four, and you know that if you don't pitch up, the rest can't row, that's very good at making sure that you get there. So doing exercise with a group is very helpful because it's a motivator. Doing exercise with a group also brings social interactions, which can be very useful. So the bottom line is there's no single magic exercise. The other important point I want to make is a dose effect. So you do not have to do triathlons to get mental health benefits. Relatively modest amounts of exercise are all you need to do. So probably as little as a half an hour to 40 minutes, 3 times a week of moderate exercise is sufficient. What you don't want to do is aim to be running marathons. That's not to say that if you are a marathon runner, that's a bad thing. But a very important element to any behavioral change strategy is to set modest but achievable goals. So if you say, I'm going to take my dog for a walk 3 times a week, you're quite likely to achieve that. If you're going to say to yourself, I'm going to do a triathlon, the chances of you achieving that are much lower. So that's generally not a helpful thing to
do. Okay. The next question is, there are many Mediterranean diets. Do you have guidelines for the one you use in these studies?
I really want to emphasize that there is no single magic diet. There is no single magic food, and anything that is a vaguely healthy diet. And again, I don't want to emphasize Mediterranean because although much of the data focuses on the Mediterranean, we know the same is likely to be true for a traditional Japanese diet, a traditional Korean diet, a traditional Norwegian diet. So anything that has food in that can rot is what you should be eating. Anything that has stuff that comes from a farm, you should be eating. Anything that comes from a factory is highly packaged and processed, you probably should be staying away from.
Okay, the next question is if yoga is considered exercise, and expanding on that, is meditation considered a useful practice in mental health management?
There's now pretty good evidence that meditation is useful. So yoga is kind of halfway between exercise and mindfulness meditation, but mindfulness meditation is now a well-accepted therapy. It adopts a number of Buddhist practices and philosophies, and there are a number of studies that have looked at meditation for the management of depression. And the majority of these studies do find that it's useful. The thing about the psychological approaches, again, like diet, there's no one size fits all. And certainly my clinical experience is some people like meditation and it fits with who they are as people. And there's some people who just cannot do sitting still and meditating. And they might prefer a more active or a more engaging or a more cognitive type approach. So in the same way that there's no one size fits all exercise, there isn't a one size fits all psychological approach. And because people are so different in their personalities, it's much more important that you find a psychological approach that fits with your personality and use that.
Do you find that taking a food sensitivity and allergy test is useful in finding a diet that doesn't upset the gut biome?
Well, I think they're two separate questions there, and I think they're both very interesting and important. The first is food sensitivity tests. There's very little evidence on the link between food sensitivity and mental health. There's a little bit of evidence about gluten, but not a lot. In terms of the microbiome, this is a massive and exploding area. There's a huge amount of interest in the microbiome. There's a suggestion that people who have depression have different microbiomes to people who are not depressed. There's animal work that says that you can transfer an animal model of depression from one rat to another by transplanting their microbiomes. So you can make a happy rat miserable and vice versa by transplanting their microbiomes. Whether this is true for humans, we don't know, but there are a number of studies that are being done now that are looking at the microbiome. What I would say, just want to say two things about the microbiome. The one is that the largest determinant of microbiome is diet. So your diet potently impacts the type of the microbiome you have. But I don't know that there's good enough evidence at this point in time for us to make any recommendations about microbiome and probiotics and prebiotics. But it's an area of very active research endeavor.
Okay, the next question is if following the proper diet, exercising, etc., can lead to a reduction in medication, and if so, should doctors be treating patients with exercise, medicine, etc., before prescribing medication?
That's a difficult one. Most of the studies that have been done have been add-on to treatment as usual. For the most part, that means existing psychotherapy or medications, but occasionally it isn't. Now, there are some people who respond well to antidepressants, but exercise and diet gives them an extra boost. There's some people who do not respond well to antidepressants and respond well to psychotherapy. And there's some people for whom lifestyle therapies are the mainstay. I would caution anybody not to interfere with their primary therapies, especially if they responded well to them. I have seen, while it's no doubt that some people come off medications and stay well, I have seen people do quite badly who've responded very well to medications and attempted to come off them. So the decision to come off treatment is one that should never be taken independently and always in conjunction with one's primary treating physician.
Okay, the next question is about adhering to regular exercise and a healthy diet during episodes. This person struggles with maintaining a healthy diet and exercise when they are depressed. Is maintaining a healthy diet and exercise while stable more important than an overall management while episodic as well?
That's a very important question, and it goes to one of the huge paradoxes that we have. It absolutely is much more difficult to follow a diet and to stick to exercise when you're depressed. You don't have the motivation, you don't have the energy, you don't have the confidence and the drive. Ironically, it doesn't make it less important. So the benefits of following diet and exercise are probably even greater if you can do it when you're depressed. The most important thing, again, is to have modest, realistic, and reasonable goals. So when you're depressed, you might not be able to go to gym, but you might be able to walk around the block. You might not be able to follow a full Mediterranean diet, but you can say, I won't have soda, I'll drink water. So having small but reasonable goals is the way to go. You got to set goals that are attainable, and you might be able to have more extensive goals when you're well and in the maintenance phase, but it's not less important to have a lifestyle goal depressed. You just have to make sure that you set your goals to what is attainable given the fact that you're not well.
Okay, and the last question we're going to take today is about caffeine consumption. Do you believe that people with mood disorders should consume any caffeine? And if so, what do you think the appropriate amount is?
That's a very important question because most of us love our coffee. There's actually a meta-analysis on this, and it suggests that moderate intakes of caffeine actually might be helpful. What you don't want to do is be loading up on massive amounts of caffeine if you have anxiety or insomnia. We know that if you are anxious or you have insomnia, caffeine will make this worse. But in terms of depression, having a cup of coffee in the morning is unlikely to be harmful and may actually be helpful. So it's one of the very few naughty foods that might be nice for you.
Okay, I'm actually going to ask one more question that just came through. It's about seasonal affective disorder. This person is concerned because it is the autumn here in the United States where this person lives, and they were wondering if you should shift your diet or exercise during seasonal changes to get additional supplements from the food, or if maintaining your regular diet and exercise is recommended.
So I don't think seasonal affective disorder will benefit from changes in diet. If you're eating a healthy diet, it's a year-round thing. In terms of the winter, I think what changes is what you can do. So you can't go jogging outdoors, so you might have to move your exercise to an indoor format. So you might have to change how you exercise, but you should try and maintain what you do. There's some evidence for light therapy for seasonal affective disorders, but that's kind of outside the mandate of what we're talking about today. But certainly bright light therapy mornings and early mornings, late afternoons may be helpful.
Okay, well, we are going to wrap this up. I want everybody to know that this will be available on our website and YouTube, as well as re-advertised on our social media in the next day or so. So keep an eye out. And I would like to thank you, Dr. Berk. This has been a great webinar. We have learned a lot. And once again, thank you for joining us.
Thank you very much.
Goodbye.